It's a pleasure. I have the honor of presenting on AI anxiety. The title of my lecture is Sources of Hesitancy and How to Face Them Head On as AI usage grows in our space. I am a fertility physician and REI, but I'm the co-founder of Future Fertility and have been working on AI in our space since about 2017, which gives me a really exciting lens, seeing the evolution and development, which also includes early adoption and hesitancy. So I have the pleasure of presenting to you guys today. I think everybody on the call probably knows AI, but sometimes these terms get mixed up. So I'll just give you a little bit of examples to give you context. So when we talk about AI, you can think of like Siri, direct commands, what is the weather outside, how's my stock portfolio going, and stuff like that. Machine learning is something that you can teach to get better. You can think of like your spam filter. So if I get an email from you and it's all capitals and I know it's not really you, I can tell that it's spam and it starts to learn what's spam or not. And probably the most famous example of deep learning is self-driving cars that we're still working on. I always like to show examples. So what I'd like to do is sort of those who may not know, ChatGPT is quite advanced these days, and I can sort of show you how it makes our life easier. I could take the presentation here and I can ask ChatGPT to create a PowerPoint for me, and it will show you what it's come up with. And within 3 minutes, I have sort of a starting of what is a very relevant PowerPoint. So I thought that was a pretty impressive, just to show you the power of AI. Sorry, so I'll share my screen one more time. Here we go. Okay, so I know we're from all over the world. I'm here in Toronto in Canada. We're very proud of some of our sports teams like the Raptors because we've won the NBA, but we're very proud of how AI has really changed in our city. There's a lot of investments and a lot of educational, and a lot of that has to do with what we call, with Professor Jeffrey Hinton. He's known as the godfather of AI because he was very early on doing research. People used to think computers were sort of if-then commands, and then he really believed that we can teach computers to be quite intelligent, and you're usually crazy till you're right, then you're a genius, and it turns out he's a genius. So we're really proud to be here in Toronto working on all this. So the reason we actually care about AI, or why you're hearing about it more and more at every conference, because it has so much potential. I think a lot of this you probably know, but the whole point of applying AI is it can make things either faster or cheaper or more efficient or more accessible or smarter, more insights than we can do. This is a really cool example I saw in the newspapers not that long ago. It was a child who had many symptoms, and it's a true story, and each symptom led him to a different subspecialist. Couldn't sleep well, went to an ENT, grinding his teeth, went to a dentist, dragging his feet, went to a neurologist. And the mom sort of put all the consult notes and the MRIs together, and ChatGPT, it's just one example of an AI model, but help put it all together, because sometimes, kind of like in the fertility clinic, we're in silos. There's the clinician, there's the embryologist, there's the nurse, there's the finance team, but it really helps us put it all together. AI is good in general. In healthcare specifically, we see it everywhere. We see it in the imaging world. We at Future Fertility are working on visualizing the eggs and predicting if it can become high quality blastocysts, and on the endometrium as well. But people have used it everywhere, whether it's more personalized predictions or drug discovery, protein folding, making things like flow better and patient experience. So you sort of see it everywhere. Now, specifically AI in the field of reproductive medicine, in my opinion, women's health is always a little bit behind in research and drug development. That could be because it's pretty politicized around the world. What is an embryo? What is an egg? And also there's the fear of harm. You do something wrong at the embryo level, it can have huge implications. This chart here, you can see sort of the FDA. FDA is the US based telling you approvals for devices. And you can see every year this is just skyrocketing. So AI tools are here to stay. But more specifically, you can see that in the field of OBGYN, so far only one specific tool has FDA approval, which is the KIDS score day 3. The point is we're lagging. It is in medicine, but it's coming. Now, when we started working on eggs several years ago, it was interesting to see every so often you would see a really great use case, whether it's embryo selection or choosing the right trigger time and so forth. But nowadays you can see sort of AI software solutions or research all across, whether it's data driven, which is like support tools. What's the best protocol? What's the best drug dose? When should I trigger? Or is it more image-based support tools like egg selection or sperm selection or embryo selection and so forth? But the point is that you're going to see narrow solutions all across the field. Now, I think we're in a really good field and a really good ecosystem to make sure this continues. I mean, all over the world, there's experts on with us, but we all do IVF a little bit differently, but essentially the same, which revolves, you know, a workup, stimulation protocol, some form of retrieval, embryo growth, sometimes testing and transfer. So we all have a very similar approach, but the data sets now are getting big. We're able to track things through EMRs. We have a lot of ways to analyze whether it's ultrasounds or data or time lapse. And we have national registries that can sort of really conglomerate all this data. So it's you can bet that this ecosystem is going to help AI solutions continue to be implemented. Okay, so you know the thesis is AI is here to stay. It's going to have a lot of potential benefits. For sure, there could be some limitation and negative sides. So why are we so anxious about it? This is an AI-generated image of an anxious embryologist. So why are we anxious about it and how can we address it? So first of all, what is anxiety or what is AI anxiety? It is the fear of integrating or the use of AI technology. And just to be clear, I do believe that some anxiety is good. If you had no anxiety, you know, you'd be jumping off roofs, you'd be implementing every AI tool that you saw. But too much anxiety is going to prevent you from actually moving forward with anything. You know, if you're going to wait for multiple RCTs and you're going to wait for 20 years, you know, by the time you get started, it might be a bit late in the game. But even the great Jeffrey Hinton, Toronto legend, has AI anxieties. His is more existential, you know, things like mass media manipulation and, you know, impacting wars or elections. But the point is we all have some anxiety, which is healthy. So let's dive a little bit deeper into it. So some examples of anxiety. So we all have anxieties that the AI is going to get so good that we won't have a job. Personally, I've not seen examples of that in our field. We have time lapse that hasn't taken away embryology jobs. We no longer create our own culture media. That hasn't taken away jobs. We have EMRs with prompts, and that hasn't taken any jobs. So I do think it might change our jobs, our roles, our responsibilities, what we're responsible for, how many our capacity, but I don't think it's going to take away jobs directly. We all fear privacy, that we're always being listened to or all our data is secure. And I think that's fair anxiety that we have to address before we use any sort of AI tool. A really big one is the learning anxiety of, you know, AI is a software. You have to sort of at least understand how it's built, how it was analyzed, how it's going to evolve. And, you know, like any new software tool, there's a learning curve to it. And we're anxious, we're not going to be able to keep up or use it well. Bias anxiety is a real thing. You know, it really depends on the data set and how diverse it is that it was built on. I think a good example of that is some sort of facial recognition and how it was designed, and maybe different skin tones, or if you've got hair that blocks your eyes and whatnot. So There's certainly biases when AI is built. Transparency is a big one because we all fear the big black box. Not so much that it doesn't mean that the AI is not accurate, but in the fact that we don't really know why it's saying that. If we're talking, for example, embryo selection, if the AI tool told us to pick this 4AA embryo and you feel comfortable with that, that's fine. But if it told you to pick this 2BC embryo, you're going to feel anxious because it's not consistent with what you would have done. So knowing the rationale or where it came from is a big deal. Ethics is another one. I'm not sure I've seen it yet in our field, but the more it's going to be implemented, the more it's going to be an issue. A theoretical example that's always told is the self-driving car and has two little children or an older man to the right, and where does the car swerve and to avoid who, and how does it make those decisions? And kind of a bigger one that Jeffrey Hinton was talking about is this fear that artificial intelligence may continue to evolve out of control and gain consciousness. And this is kind of where we see Hollywood with Blade Runner and Ex Machina and Westworld of these robots will be working for the robots is the fear. Okay, there are more anxieties that we have to touch upon. There's what we call trust anxiety, which comes from the black box. Like, how do we know that what is saying is based on the actual thing? A good example that I've seen in our field is, there were studies where they were trying to do embryo selection, and quickly they found out that, labs that hold their embryos with the pipelle had a higher success rate than those that didn't, and the AI machine was maybe picking up the pipelle in the background versus the embryo. But the point is the transparency and accountability really helps us figure out if this tool is useful or not. There is patients' concern that, is the AI making these decisions? Is the doctor using the AI to make the decisions, and what level of that impacts them? A lot of us worry about how this integrates into our everyday practice. I think I've heard it on the i3 webinar before, which I think is a really smart thing, which is to say that, some people feel that clinicians, embryologists are becoming software engineers. We have so many tools and software programs that we've got to learn how to do it. And the list goes on. We have fears of how it's going to impact our relationship with patients. Some people wonder if they're going to be talking to a chatbot the whole time, but the other side of that is maybe your doctor doesn't have to be typing on a screen while he's talking to you. Maybe because you have an AI bot that types for you, I can sort of make more eye contact and add more empathy to it. There's a fear that there isn't, you're going to implement an AI tool, but you really didn't watch the results. Is it as predicted? Is it worse or better? And are you tweaking it along the way? So this feedback loop is important. And of course, we don't want additional costs to the patient. It's already a difficult thing to access. And us clinicians always worried about the perceived education of the patients. If they expect a perfect AI tool and the outcome is less than perfect, then that's one extra patient we have to manage expectations. The i3 webinar gave out a really great survey last year, over 90 countries. And the main findings of it is that in general, embryologists believe AI is going to be part of our future. Half of them are ready to use it now, and 3/4 are in the future. The main issues for them is that they wonder if it's worth the extra added cost to the patient. What are the science related to the outcomes to it? And transparency and knowing how they make decisions is super important. When physicians are asked their perception of AI, they also feel like it's going to be part of their future, mostly to help them diagnose and to improve workflow. But their main concern is that, if I used an AI tool and, I was wrong or led to a bad outcome, how much how much of that is my fault to rely on an AI tool that I wasn't involved with? Of course, we all want to have the more evidence, the better. And so having strong clinical evidence is important, as well as data privacy. We want to make sure that these are in secure, closed systems. When you ask students, students are kind of a unique subset because they don't have the expertise that somebody who's been working in the field as well. So sometimes when you use an AI tool and it just doesn't fit your gut feeling, you as an expert can use that as just one data point to make your decision, where students may be more reliant to just follow the algorithm. So having a lack of experience makes students' adoption a little bit trickier. When you ask patients about it, overall, they do support AI in the field. They just want to make sure, at least at this point, that it's your doctor using AI and using it properly under the right regulations and the way it was designed to do, and not sort of this autonomous system that has nothing to do with a safety net like a doctor. Okay, so it's normal to have AIs coming. It's normal to have anxiety, but how do we address our AI anxiety so we can move forward and, not be left behind on this AI revolution? So I would say there are three pillars. One of them is learn a little bit more about AI. Once you see that it's not as scary and it's just a tool, and use it within its limitation, I think that's a key one. The second one is understanding that there are regulations and frameworks that AI is designed in, might make you feel a bit more comfortable. And the reality that AI anxiety is kind of a new thing. We don't know where it's coming from. We're all anxious about different things. So studying where our anxiety comes from might be helpful. So we at Future Fertility have paired up with FAIR in Canada, and we're interviewing embryologists and clinicians and patients, how they feel about it. Okay, so let's start by understanding AI a little bit. So a key thing is, at least now, 2024, we're still talking about narrow AI, which means you have to define a specific task. For example, will this egg become a euploid embryo or not? That's the task. So you can't not apply that to a different questions like, will this embryo implant or not? Because that's a different question that it was not designed on. You need to understand the sample size. Was it 24 patients? Was it 2,000 patients? Was it in a single clinic? Was it across the world? You want the diversity of outcomes. If you're talking about figuring out euploid or not, you want a big data set of aneuploids, mosaics, and euploids, and so forth. And of course, you want to do labeling. What is the honest truth? So, if we're talking about egg to blastocyst, if you have an embryo that was transferred on day 3, a cleavage, do you label that as a blastocyst? You can argue not. You don't know. It went into the uterus unless you got pregnant. Or do you label it not a blastocyst, or do you not include it in your data set because you're not 100% sure? So having a diverse, large data set, we call this clean data with clear outcomes, will really help AI. So whenever you see a tool, these are sort of the framework you should be thinking about. What was the task? How did they set it up to answer the question? Now, the data scientists on this call, when you show them a model and you show them their outcomes, they can interpret it and analyze it in ways that the rest of us can't. But we still have to understand a little bit. In the very least, we need to understand things like the area under the curve, and accuracy, and specificity and sensitivity. So just high level, an area under the curve of 0.5 is kind of like a flip of a coin, where 1.0 means you can rank this perfectly into the yes or the no category. Okay, this one is important to me. I feel like one of the anxieties we have about AI is that we judge it based on perfection. They said to select embryo 2, and embryo 2 did not lead into implementation. And if you judge it based on perfection, you're always going to fall short. And I think it's not so fair, because we don't judge our clinicians or embryologists based on perfection. We judge it based on standard of care. So we as humans have our own limitations and biases. You know, you really don't know how many conferences your doctor went to or what articles they read and what they remember from him. And sometimes, you know, we pick a protocol because it just worked on a patient very similar to you, but we don't remember a patient we saw that it didn't work for 3 months earlier. You know, when we think of this black box of AI, it is a real concern, and we are trying to make it into a glass box. But you can appreciate we have a lot of black boxes infertility. You don't know why your physician made that decision. You may not know why the embryologist chose that embryo. So there is a black box in our day-to-day anyways. In terms of regulation, I support this evolution, but it is also important to realize that there are many things that we do day-to-day, whether it's ICSI, PGTA, or whatnot, that don't have such strong regulations as well. So I'm not saying accept AI as is. I'm just saying instead of judging it by perfection, maybe compare it to the current standard of care. Okay, this is just a quick note to say that, you know, AI at the moment is seen as a software, as a medical device, and it's a very hot topic and very evolving. There are global guidelines like the WHO that are always in flux, so keep an eye on it. And certain countries have certain regulations, but this is evolving very, very fast. One thing we've seen at Future Fertility, we work with clinics across the world, is we can see that adoption seems to be faster in countries where they feel less anxious about AI. They understand its limitations and within the regulatory. And that sort of ties up to our talk today, which is, you know, how AI anxiety could stop us from moving forward. Now, when you decide to use AI in your clinic, you know, I think it is a whole team approach. You need to come up with all your decision makers, your departments, your nursing, your admin, your finance, your embryology. You have to really define what is the clinical scenario that you're attacking. How will the AI affect the workflow? How will you be counseling the patients? Impacts on data privacy in the support team. How will you keep track on the outcomes, and does it work the way it works? So one of the issues why AI is slower to implement is it takes a lot of work. It's not just a single person deciding yes or no, but it's a whole team game here. But my takeaway messages for everyone is that the revolution is coming. It's going to be in fertility sooner than later. At the moment, we're talking about narrow solutions. It is good to be anxious because you stop and you think, but I think the more you learn about AI in general and understand the regulations that it's designed under, the better. I do not believe that AI will replace humans, but I do think it will evolve the future of how we work. I don't think AI will replace anyone, but I do think someone who uses AI properly might. And I think if we compared AI to the current standard of care instead of perfection, I think that will help ease our anxiety about implementation.
Test.
Thank you so much.